Welcome. In this lesson, we'll continue to discuss measure theory as it relates to creating measures in Ursa Studio's Measure Workshop. By the end of this lesson, you'll be able to answer the question, what is a measure's temporal structure? Thus far, I've described measures in terms of their numerator and denominator relationship, but there's another key aspect of measures. And that is how these numerator denominator relationships relate to time. So let's recall our bloodstream infection measure. It's really helpful to know the rate of bloodstream infections within a hospital, but it's much more useful to be provided that information at regular intervals across time. When we see the measure presented in this manner, we can start to get a sense of a narrative about this hospital's bloodstream infection rate. It rose in the winter, was stable in the spring, fell in the summer, and began rising again in the fall. In Ursa Studio, there are various ways to configure the way a measure is related to time. The cornerstone of this measure theory course is anchored around each of these options, which we call the measure's temporal structure. A measure's temporal structures can be one of four types: event, timeline period, timeline snapshot, and static. The event temporal structure is used when a measure's denominator observations represent a single moment in time. For example, this measure considers CKD patient readmissions. For each patient, the admission can be tied to a single date and a single moment in time. The timeline period temporal structure is for measures where the denominator observation represents a period of time. For example, this measure, accounting for the number of admissions per 1,000 patient years, surveys the number of admissions for every 1,000 patients over a 1-year period of time. The timeline snapshot temporal structure is for measures where observations represent entities, like patients, who exist across time and whose performance is measured on recurring snapshot dates. For example, this measure, accounting for the percentage of CKD patients who are enrolled in Program X, does not measure an event, nor does it measure something within a period of time. It's measuring patients who are enrolled in a program. The measure's objective is to report on a specific dimension of performance about the program, such as, is the percentage of CKD patients who are enrolled in the program increasing or decreasing? To account for this dimension of performance, we check in on the measure's performance on recurring intervals, like the first day of each month. That is, we take a figurative snapshot of the measure's performance on the recurring interval dates. Finally, there's a static temporal structure for measures that do not report the denominator observation's relationship to time. For example, this measure provides a count of the number of outpatients' GFR labs completed without consideration of time. So now you have a sense of the four temporal structures, or the ways in which a measure's relationship to time can be configured in Ursa Studio. Next, we'll introduce a few additional concepts related to measure authoring. Thank you for reviewing this lesson. We'll pause there, and I'll see you in the next one.